Order. Question number 2, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What is the total amount of efficiencies that Capital and Coast District Health Board have made in 2015-16?
The Honourable Pesata Sam Lotu-Iiga.
Thank you, Mr Speaker. On behalf of the Minister, the theoretical savings for the 2016 year are estimated at around $40 million or 3 to 4%. Of course, DHBs are always required to make efficiency savings, and it was no different under the previous government. The context for this, of course, is that 8 years ago, the deficit was $66 million within that District Health Board, and it is now around $12 million. The important thing to note, though, is that the Capital Coast District Health Board at the same time have lifted their services across the board, including over 50% increases in surgeries and hip and knee surgeries up 76%.
Point of order, Mr Speaker.
Point of order. Order. The Honourable Annette.
I seek leave to table an official information request I received from Capital and Coast District Health Board dated the 12th of February 2016 that points out it is not a theoretical $40 million saving plan. It is $40 million.
I will put the leave sought to table that particular Official Information Act information. Is there any objection? There is none. It can be tabled.
Question, Mr Speaker.
Supplementary question, the Honourable Annette.
Is it acceptable, in order to meet a $40 million in efficiency, he requires Capital and Coast District Health Board, Coast District Health Board, that funding is to be cut from primary health care in the region, which the largest PHO has said is unmanageable?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, I can't confirm that figure that the member just stated, but what I can say is that the funding increase for the District Health Board has gone up over 8 years of $198 million. That is 34%, well ahead of inflation.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
How can mental health services be, quote, right at the top, end quote, of his priority list when funding for primary mental health services provided by GPs and NGOs in Capital and Coast District Health Board are to be cut to make savings that he is demanding?
Well,
the Honourable Pesata Sam Lotu-Iiga.
Well, Mr Speaker, I again query the figures that member presents, because the figures that I have to hand show an increase in mental health expenditure in that District Health Board area by $17 million or 21% in the last 7 years.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
How can his concern about mental health services be taken seriously when the following cuts have been made in funding? $118,500 from Compass PHO, $260,000 from Te Awa Kairangi PHO, $150,000 from Newtown and Purirua services, both very low cost access services, and community health services in the region.
The Honourable Pesata Sam Lotu-Iiga.
Well, again, I dispute the relevance of that, given that we've increased mental health services, not just in the last year, across the board. They're not cuts. They are in proportion to the total funding that the District Health Board makes, and that's gone up $200 million in the last 8 years.
Supplementary question, the Honourable Annette King.
Will he rule out in this House today that there is absolutely no impact on mental health services in Capital and Coast District Health Board?
The Honourable Pesata Sam Lotu-Iiga.
Well, Mr Speaker, I refer to my previous answer, which states that the mental health expenditure has gone up year on year, ahead of inflation in the last 8 years.
Point of order, the Honourable
I asked if he'd rule out if there'd be any cuts. I don't care what the funding has gone in, would there be any cuts?
No, but the member can't demand a yes or no answer. I accept that she can be dissatisfied with that particular answer, and I will allow the member one additional supplementary question.
Thank you, Mr Speaker.
A supplementary question, the Honourable
I did happen to have a fifth one here that I didn't think I'd ever get the chance to do.
Move on, then. The Honourable Annette King.
Mr Speaker, why would the Chief Executive of Lower Hutt District Health Board say that publicly that he has had to cut funding for mental health services this financial year?
The Honourable Pesatara Sam
Well,
Lotu-Iiga.
Mr Speaker, I can't speak for the Lower Hutt District Health Board. In fact, is there a Lower Hutt? There is no Lower Hutt District Health. There's the Hutt Valley District Health Board, where the funding has actually gone up $415 million over the last 8 years, and that member knows that spending has gone up.
Order. Order. Supplementary question. Chris Farfoy.
To the Minister, does he think it's acceptable that to make his savings, the Capital and Coast District Health Board is considering closing the overnight GP service at Kenepuru Hospital, which could see some families in Kapiti and Porirua travel 50 k's, much further than they do now, to see a GP in the small hours of the morning?
The Honourable Pesatara Sam Lotu-Iiga.
So what I can say about this District Health Board is that there are over 176 more doctors that are on the front line, sir. There are more than 387 more nurses on the front line, and that's better than anything that Labor government did in their 9 years.
I'll allow the member to repeat the question.
Okay.
The member may not have heard it.
To the Minister, does he think it is acceptable that to make his savings, the Capital and Coast District Health Board is considering closing the overnight GP service at Kenepuru Hospital, which could see some families in Kapiti and Porirua travel 50 kilometres, much further than they do now, to see a GP in the small hours of the morning? Or is that an example of the CCDHB lifting services?
Order.
Well, Mr Speaker,
Honourable Pesatara Sam
as I've
Lotu-Iiga.
said to that member, the spending has gone up on GPs and nurses in terms of primary health care. We know there are more frontline doctors, and we know there are more nurses.
Order. Question number 3.